The American Cancer Society estimates that more than 4,000 women will die from cervical cancer this year, despite it being highly preventable. A main prevention strategy is making sure women get screened every 3 years. However, the guidelines have changed as we continue to learn more about which tests are effective and which are completely unnecessary. These changes can make a huge difference for how comfortable women are during the appointment. For example, bimanual pelvic exams used to be a normal part of the annual screening procedure, where the doctor would insert their fingers inside the vagina to feel for any abnormalities.
You would lay down, you'd take off your underwear, you'd be on the table, the doctor would put their fingers inside of you and feel around to see that things were, quote, normal. And well, we've proven that people can't tell where the ovaries are when you actually look at it with ultrasound, that people's feelings inside the vagina don't lead to diagnoses unless the woman already has an issue that she wants to talk to you about first before you put your fingers inside.
That's Dr. Diane Harper, a professor in the departments of family medicine and obstetrics and gynecology. She's an internationally recognized research expert in HPV-associated diseases and their prevention. The bimanual exam was discontinued as a routine procedure because research shows it's not effective on its own. But while many patients can avoid the hand examination, most will still have to have a speculum exam during their annual visit.
Speculums have been around for over 3,000 years. They initially were made as wooden instruments. They then became metal instruments. They are two plates that are put inside the vagina and used to pry the vagina open. They're now plastic in most cases, and oftentimes they'll have a lighted plastic with it that allows the physician to be able to actually see the cervix to address any particular issues that are happening at the cervix.
In addition to a visual examination, the physician will keep the speculum inserted and use a long brush or spatula-like instrument to scrape cells off of the cervix. The standard screening procedure used at the moment is called co-testing. This is when the collected cells are used for both a pap smear and HPV test. The HPV test looks for high-risk types of the virus, while the pap test checks for cervical cancer cells or abnormal ones that could turn cancerous in the future. However, since cervical cancer is almost always caused by an HPV infection, Harper says that there's no reason to get both tests.
We now know that cervical cancer, 99.9% of the time, is caused by human papillomavirus. It's caused by HPV. So the most accurate test is going to be, do you have HPV or not? If you don't have HPV, it doesn't matter what all those little cells mean, because those cells are not accurate in a way we'd like to think of them as being accurate. They were accurate when they were the only thing we had, because that's all we had. And we used that from 1929 when Dr. Papanicolaou first came out with the pap smear, and now it's outdated. Now it's your grandma's test.
Instead of co-testing, primary HPV screening is starting to be the top recommendation. The pap smear involves visually inspecting the collected cells under a microscope for any signs of cancer. The primary HPV tests, on the other hand, are objective diagnostics that have been shown to prevent more pre-cancer and cancer. The World Health Organization, American Cancer Society, and American College of Obstetricians and Gynecologists have all adopted this recommendation. And though both tests use the same speculum examination, Harper says that's probably going to change soon too. In 2024, the FDA approved self-collection methods of HPV testing that women can use themselves in a healthcare setting.
You can use the Evelyn brush, which is like a soft plastic, longer tampon that the woman can put into her vagina. She turns it around. It's got a little handle on it. You turn it around 5 times, you pull it back out, and then you either give it to the lab person or to the clinician, and they put it in the little vial of liquid that the doctor who's doing the speculum exam would normally put their stuff in, and then it gets sent off. So literally, it's like using a tampon.
Another option is a swab that's very similar to what many of us use to test for COVID. It's inserted into the vagina and rotated to swab gently along the vaginal walls, then pulled back out and sent to the lab. Self-sampling would be a huge shift in the status quo. All of a sudden, the speculum, a design that's remained largely unchanged, would be rendered obsolete for many patients. It's a big adjustment that may sound scary, but thankfully we have other countries that have already successfully adopted this method. Sweden, for example, announced in 2022 that HPV self-sampling is leading to faster elimination of cervical cancer. Harper is part of a research team trying to create the same progress in the US.
We just published that. We are the first US-based population that shows that we have nearly 100% accuracy between self-collection and speculum collection. This is the first paper in the United States that is doing that. We currently have an NCI study that is also looking at 26 different sites in the United States, and we are in the first year of that trial. We hope that trial will continue, that we'll be able to provide a multi-site confirmation of the results that we already have.
While their research is specific to America, there's a global pool of positive results that have been shown over decades to back up the success of self-administered HPV tests.
Our European colleagues are 20 years ahead of us. The Netherlands already has self-sampling with primary HPV testing as their national test. And they've been doing this for a long enough time to show that it more accurately detects women with cervical cancer precursors, and it allows the need for going to colposcopy to decrease much quicker. And so it's incredibly successful. You partner HPV vaccination with primary HPV screening and self-sampling, and we really can get a control over cervical cancer that we haven't had for 20 years. The cervical cancers just continue to bob around with nobody making any dents in it to any significant amount. We can now do that, and it's very exciting.
The initial pushback people may have to self-sampling is the user error that comes with it. Many of us aren't doctors and have no formal training for using medical devices. Thankfully, Harper says it's almost impossible to swab incorrectly because of how an HPV infection spreads to the cervix.
It has to start on the vulva. That's where she's first exposed. HPV is first there. HPV then is like the entire vagina has exposed to HPV before the cervix is ever exposed to HPV. So you know that vaginal canal, if her cervix is going to have HPV, her vaginal canal has to have HPV. It just cannot exist. It's not biologically possible in any other way. So it doesn't really matter. What matters is that you put the swab in at least 3 to 4 inches and that you kind of just turn it around the best you can. You don't need to make bread, right? You just need to gently just turn it around between your finger and your thumb and pull it back out, because the vagina is more than happy to give you a sample without pain that is equally accurate as a speculum that goes straight to the cervix to check. In fact, we find more HPV because it's in the vagina than some doctors find when they're getting it on the cervix. So the specimen collection is actually better with the self-collection.
So if self-sampling is just as, if not more, accurate than the normal procedure, why do we continue to use a speculum? Join us next week as we discuss the medical field's resistance, as well as how self-sampling increases health access for women with physical disabilities. You can find more information about Dr. Diane Harper and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.